Restrictions are escalating around the world tonight in an effort to control the coronavirus outbreak. Schools are being closed, travelers are facing quarantines, and even the Church of the Nativity in Bethlehem has been shuttered. In this country, Congress gave final approval today to an emergency funding measure as Washington State announced an 11th death, making 12 nationwide. William Brangham begins our coverage.
Another cruise ship stuck at sea because of coronavirus. 62 passengers are quarantined inside their cabins, anchored in San Francisco Bay, after a passenger from a previous voyage on the ship died of COVID-19. Elsewhere in the country, 2 new states had their first confirmed cases, Nevada and Tennessee.
While we are saddened to learn that this virus has now reached Tennessee, our recent preparedness efforts that the governor just mentioned have positioned us to respond swiftly and thoroughly.
In Washington, D.C., the Senate Homeland Security Committee heard from administration officials on the federal preparation. Republican Chairman Senator Ron Johnson said no response is perfect, but the Trump administration is doing all it can.
The chances of the administration getting it just right, reacting perfectly, is zero. It won't happen. But again, from my own knowledge, my own interaction, what we've seen in terms of the interaction with the Senate and the House, this is an all-government approach. This is all hands on deck.
Vice President Mike Pence, who's leading the national response, echoed that sentiment during a trip to Minnesota.
We're going to continue to bring the full resources of the federal government to bear to confront the spread of the coronavirus.
But in a phone interview on Fox News last night, President Trump seemed to contradict guidance from public health officials about whether people should go to work if they think they have the virus.
We have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work, but they get better.
And he casts some doubt on the latest projections from the World Health Organization about the virus's death rate.
Well, I think the 3.4% is really a false number. Now, this is just my hunch. But based on a lot of conversations with a lot of people that do this, because a lot of people will have this and it's very mild.
And a senior health official today explained why the death rate could be lower.
What the WHO numbers that you see do not take into account the people who don't come into contact with the medical facility. That's the reason between the difference of a 2 to 3% mortality and a model of what it might be with a big range if you counted people who are asymptomatic.
Other experts warned that going to work while infected is dangerous and could exacerbate this outbreak. Lawrence Gostin specializes in global health at Georgetown University.
It's very clear from a public health perspective that if a person has flu-like symptoms, they should not go to work. They should not go to school, because what we know about this coronavirus, and we know it very clearly from other countries and from the United States in King County, Washington, is that it spreads very rapidly in congregate settings when people are crowded together.
Gostin also took issue with the general message the president gave last night.
I think the president's tone was to understate the seriousness of COVID-19. COVID-19, no matter what the fatality rate will be orders of magnitude more deadly than the flu.
That threat is why so many cities are closing schools and workplaces are shutting down across the globe. In South Korea's Daegu City, which has borne the brunt of that country's outbreak, usually bustling train stations were empty today. A few brave riders kept their faces covered with masks. In Italy, primary school employees put up signs in Rome informing students class was out until at least March 15th. Back in the U.S., the Senate passed an $8 billion emergency spending bill aimed at combating the virus domestically. The president is expected to sign that bill soon. For the PBS NewsHour, I'm William Brangham.
Economic worries over the outbreak weighed down Wall Street today and wiped out most of yesterday's big gains. The Dow Jones Industrial Average lost 969 points to close at 26,121. The Nasdaq fell 279 points, and the S&P 500 dropped 106. The coronavirus outbreak is also increasingly straining the healthcare systems and economic resources of countries around the world. This week, the International Monetary Fund announced a $50 billion aid package intended to help various governments buy needed medical equipment and ease expected slowdowns in business activity. Kristalina Georgieva is managing director of the IMF, and she joins me now. Welcome to the NewsHour. So,
thank you for having me.
So, first of all, the question is, which countries are going to get this money?
The 50 billion is made available to both low-income countries and middle-income countries that may be severely impacted by an economic slowdown, as well as the need to respond to this crisis. For the low-income countries, this is zero-interest loans. For the middle-income countries, the regular conditions of the IMF. What I want to stress is that what we want to make sure, Judy, is that people don't die just because of the lack of money, and businesses don't collapse only because of the lack of immediately available credit.
So how do you do that? What exactly are you expecting countries to do with the money?
So what we're doing at the moment are two things. We are engaging with governments to look at the countries that are at higher risk, either because their health systems are weak or because they are commodity exporting countries and prices are going down, or they don't have fiscal space. They just don't have the money to be more aggressive. And secondly, we are discussing with our sister institution, the World Bank, how we can collectively support countries to make the right decisions. And what we are telling everybody is, number one, invest in your health provision, especially targeted to more affected communities. Number two, immediately put in place a plan, even if you don't yet need it, to help businesses and to help families to cope with the economic impact. Because what we have in front of us is a rather unusual shock that affects both demand and supply. And that requires a rather unusual set of measures that we want countries to put in place as quickly as possible.
And you say as quickly as possible, so I'm assuming you mean you have methods to get them the money very unusually quick.
Yep.
But I also want to ask, how can you make sure they're using the money the way you want them to?
Well, this is why we work with the World Bank as well. The World Bank, different from the IMF, is grounded in countries. They have a lot of knowledge about health systems. They have a lot of staff personnel on the ground. And what we want is collectively to give policy recommendations and then have these recommendations followed through. Because it is emergency financing, we can provide the resources virtually within weeks, even sometimes within days. But then there has to be support for countries so they can spend this money wisely. And this is a case when the international community truly needs to come together.
How confident are you right now that world leaders are addressing this as they should? One of the reasons I'm asking you is because there's a lot of conversation today about President Trump, for example, speaking about the mortality rate not actually being as high as it reportedly is. How do you assess how leaders are doing their jobs on this?
There is clear recognition that we do need to work together. And we had Secretary Mnuchin, Chairman Powell, all the leading ministers of finance and central bank governors uniting and expecting from us, the international organizations, to be the platform to bring speed of action. We need to lean forward in this crisis with collective resources. And I want to make a very important point for our viewers now. We know from previous health crises that only 1/3 of the cost, the economic cost of the crisis, is from direct impact. People, unfortunately, dying, not going to work, production shrinking. 2/3 of the impact is loss of confidence, uncertainty. So we have a very important role not only to act, but to communicate these actions, be together in the face of this uncertainty so we can reduce the suffering and reduce the economic burden.
Well, the seriousness is certainly coming across with what you were saying. Kristalina Georgieva, the Managing Director of the IMF, thank you very much.
Thank you.